Hi, I'm Ahava Friends. Today, I'm joined by my good friend for like ever, Chris Boyer, to talk about digital transformation. You've got questions, we've got the answers. Let's get to it. Hi, Ahava. We've seen so many institutions just switch platforms without real impact. How can we make sure that our upcoming digital transition isn't just a change in location, but a genuine leap forward in patient engagement?
Really big question, and it's a really important one to ask because you are right that the person who wrote that in is right. I have seen a lot of organizations that every 3 years they switch some kind of technology platform. And when we first got into the space, a lot of it was around like CRM or things of that nature, but also website technologies and website platforms. And a lot of it is maybe they are sort of chasing after sort of the newest technology that's out
Shiny
there.
bright object
Yeah,
syndrome,
that happens, right?
endemic in our industry. Yeah.
Right, right. SBOS, right? I think also part of it is because they invest and spend time looking at a technology, but they don't really understand the full term of implications of implementing that technology. And so it leaves them kind of in a quandary every number of years where they're saying we can't grow anymore. We can't scale for our business. We can't make this work for whatever the new widget, the new AI chatbot that's coming, or our EMR is starting to introduce now online appointment scheduling. How do I do that? A variety of different things that kind of comprise the digital space.
I want to push back though, because I've done a lot of projects in the last couple of years where this move towards consumerism, the digital front door, online scheduling, these are all really, there seems to be a demand from consumers for this. And I get that for like primary care and even, maybe, your endocrinologist or secondary care, like we would say specialty care. But at the hospital level, like when you're going in for like a breast cancer consult or you're going in for a transplant consult, does online appointment scheduling really make sense? Is that what we're really trying to do when we talk about transforming patient experience? Like, what does that really look like
Right.
holistically in the space? Because I find that with the shiny bright object syndrome that we all have in this industry, it's like they focus on this one use case that is that really
Mhm.
transformative?
It isn't. And you bring up a really important point, and something that I have as a moniker to the work I do is that you really have to understand exactly what your customer wants and what your customer needs are. And not all customer needs are the same. When you think about digital front door, I sometimes hate that term
Oh my gosh.
because it doesn't really make sense. First of all, it implies that there's just one front door, or that it's a front door and not a back door and not a side door and not a other door.
Right.
Digital front door is neither digital nor a front door. Discuss amongst yourselves, kind of thing. You always want to start with really understanding kind of the wide spectrum of use cases that are needed out there. Now that's hard. That's a hard thing to do because if you think about that, different ways your integrated health system, large or small, there's multiple ways that people are going to engage with you at multiple times across multiple different avenues. But
Yeah.
one thing is for certain, there's going to be digital as part of that in some way, shape, or form. At a certain point in time, you're going to want to, contact your doctor somehow through a portal. You're going to want to somehow look to see if there's availability for an appointment, or maybe
Easily
reschedule your
send your medical
appointment.
records.
Yeah, where to
That's
send your
one.
medical records. If you're, low acuity stuff, you want to see, hey, can I just stop by an ambulatory surgery center? And can I make sure that when I do, my medical records get shared with my main records that my provider has? And you may not even be seeing a provider or primary care provider that's owned or employed by a health system. And so you want to make sure there's some kind of digital connectivity there. Everything's digital nowadays. We kind of take it for granted, right?
Well, wait a second. So we say everything is digital. And I don't know about your last 10 times at the doctor's office, but they have all my information. It's always in the portal. Nothing's changed. I haven't started taking new medications. And yet they print out 5 pieces of paper,
Mhm.
either ask me to fill them out again or put them in. And then they photocopy my insurance card and my license every single
Again, every
time.
year. Well, and that's because, that's the sort of we're inheriting a lot of old legacy type of things.
Exactly.
What you're describing is a lot around patient safety and also, the changes in medical records and the changes in your insurance information and all that. It happens to me too, right? When I go to the dentist and other things like that.
But what you're talking about is taking out friction.
Yeah.
And we don't do, I think, a really good job of thinking about both the friction on the patient side and the friction on the doctor side. Like, what if somebody was brave enough to say, we're not going to do paper records anymore? We're just
Yeah.
not going to do it.
Well, we are mandated not to do it anymore in the health system space.
Right.
To have an
Exactly.
electronic medical record for every patient. But it's interesting the point that you bring up about eliminating friction, because I think that's really what it is, right? It's eliminating friction. But I think what's happened is the technology that's out there has kind of teetered all the way from we're eliminating the friction on the provider and we're putting all the friction onto the consumer or the patient. Or maybe it's vacillated the other way, right? And finding a
Right.
healthy balance is where you really need to make it work. But when we think about that, it gets really challenging. The other challenging piece of it is there's so many pieces to our environment that comprise how we interact with organizations. And now this is where offline and online kind of come together, right? You could check in at a doctor's office. You walk up into your doctor and you can check in. They're taking that information, they're putting it into the record that you've checked in, right? They're doing that. Or you can go to a kiosk and you can do it yourself, right? Okay, those two different options. When you're admitted for some kind of procedure or treatment in an ambulatory center or within a hospital, there's multiple different touch points and multiple different technologies that are kind of working together in order to ensure that what is happening is there's a continuous nature to that. What that kind of brings up from a digital perspective is this concept, and an important part of future proofing is composability. The ability to share information between systems. We're never going to be one system as much as some EMR companies want us to be. Fortunately, that is not the world we live in. Even if you go to the VA, you're not going through just one system.
No,
There are multiple systems. You have to build systems that kind of serve those particular points. When you get your MRI scan, or you go in and you do some kind of lab work, all of those things are tracked within separate systems and they kind of come together. Now, EMRs do a very good job of putting all the clinical information together in one continuous record. There's a lot to be said, though, about having them take that information out and share that with others, right?
yes.
I was just reading a post that a provider wrote that says, that there are some intentions that in the future you could do that for a fee, right? Like that's the way EMRs are thinking about growing their business, is to build it like sort of a subscription-based service. You want access to my medical record, et cetera. What's interesting about that all, though, is you lose the customer in the middle of that, right? Me as a patient, there used to be one point in time where you would have to pay to get your medical records.
Yeah.
Now you get them for free. That's because of a mandate, a law that was implemented. But if you think about that, if I want to be transferable with my information, how do I do that, right? All my information is captured in one EMR, maybe another EMR, and my dental records over here, et cetera. Composability is sort of the framework that we have to start to adopt in the digital space, and that will help you with future proofing. And that's a big picture view of like what's that.
So I'm hearing two really important things here. And when I'm listening to you talk, I'm thinking about how does a technologist like yourself really educate an executive? And the first thing I'm hearing is this is never, ever done. This is always going to change. We're always going to improve. We're always going to have to rethink the journey, rethink the technology. I think that's a really important thing, because there used to be this attitude, I especially know it with content, set it and forget it. We're digital marketers at Ahava Media Group, right? Like we're thinking about the whole life cycle. And then there's this thing that's like, we're going to write it and then we're not going to touch it for 3 years. Well, that's probably not the best way to think about it.
That's right.
And that's what you're saying about the technology and the whole building this ecosystem. But
that being said, though, there are certain things that you could land on that could last you longer than the short 3-year life cycle.
Okay.
Right. And so, in my mind, I think about 3 different things from, now I'm speaking specifically from a marketing perspective.
Yeah.
Right. If you're in a digital marketing environment, you want to make sure you have the right content management system for your website. The content management systems that are widely at play right now ensure scalability and security and all of the things you need, the flexibility you need to really build on. And you don't have to rip and replace those. Many, many years ago, I worked at Northwell Health. And we implemented a CMS that is still in play today. It's still being used today. And that was like 10 years ago, a little bit more than 10 years ago.
Great.
Right. And they're still using it because they chose an established content management system that can grow and scale. There are a number of them that are out there. I won't name names, so to speak, right? But there are a number of them that are out there that you could do that. So that's the first thing. The other thing is, and this is something you and I have talked about often on my podcast and elsewhere, just offhand, is looking at your content strategy and defining a content strategy that can actually meet the scalability needs. There is a sense of like, there is evergreen content. I know we've talked about this before. There are some evergreen pieces of content.
A lot of pieces.
Yeah, a lot of pieces that are important, and you need to get those set and in place, right? But then where the variation occurs is allows you for that scalability. Like there may be different treatments, there may be different ways to access care, there may be different things that happen. But you have to look at, as you called it, the content stack, which is a really good point, right? You have to look at your content stack and build it appropriately that way in order to support that. And then the last thing is you have to really understand how your users, and the users could be patients, could be referring physicians, it could be your customers, how they're interacting, what their expectations are, and ultimately what their journey is going to be, right? And so that's kind of that user-centered design approach, that you want to adopt. If you have those, and those are more like disciplines, if you think about that, right? CMS is one thing, right? And CMSs are evolving to become digital experience platforms, which is a whole nother, we won't go into it today. But the thing is if you have those kind of things as cornerstones of what you're doing, you can build a very adaptable framework without having to rip and replace things every 2 or 3 years.
These are excellent points. So first of all, just to sum up, CMS, content strategy, and then the last one was
Voice of customer, customer journey
voice of
management.
customer journeys. Okay, so that's really, really helpful. So in thinking about that and in thinking about, so first of all, what came to mind for me was I just wrote a newsletter where I talked about if you can't answer these two questions, you can't win. And the first question is, how does a business make money?
Mhm.
And do you know your audience well enough to how they tie their shoes?
Yeah.
And I love how that relates back to the other point about, really looking at the different use cases of how users want to come in. And then how do you decide what's the most important? So in my head, the most important one is, how does a business make money? Like, what's the most important
Mhm.
user cases to define to release friction?
Mhm.
What do you tell your clients when they're trying to
It's
prioritize it?
similar in that regard, right? What are the high impact, high reward,
High
um,
impact, high reward. Yeah, I love that.
where that align to your strategy? I think everything aligned to where you want to go as an organization. Health systems and provider organizations, they have different goals for what they're trying to accomplish, and that's fine, and we want to support that. But ultimately, being able to look at and assess, like, these are the things that are most impactful to my organization. And a lot of organizations now are saying we want to bring the best experience to the patient, right? So now they're prioritizing that, which is great. I think that these things give you sort of a focal point of, like, okay, if you say this is most important to your organization, the most important thing for you to do, how can we start to dissect that now and understand how all of these things, right? Your customers, their needs, their wants, and how you can make sure they're there, your content, and then importantly, the technology can support that. And that gives you the ability to say, hey, maybe I don't need this little fancy chatbot widget on my website. It's not serving a good need. And I can use those resources and dedicate it to maybe building out something a little bit more stable or more structured around the key service lines that we want to do. Or maybe I shouldn't be optimizing on how to promote the physicians in my organization through fancy videos, and instead look at ways that maybe we can make it easier for them to pay bills. You
A
know,
100%. I can't tell you how many times when I present or, my content strategists create discoveries that we say to them, here's where the majority of your traffic is going. And
hmm
it's completely ignored in your content workflow. Like, this
yeah,
is the stuff that really, really matters. And this is the stuff that's pulling your people in. And these are the pathways that they're following. And this content hasn't been looked at or improved in so long.
mhm.
And I find that it's often the actual content itself, whether it's written, video, pictures, whatever. But I also find it's the thinking about the user, just even on the template itself, like what design really encourages interaction. And
Right.
so, yeah, I think it's constantly work in progress. And I think that organizations really need to focus on the things that really make the needles move. And the most important needle is, the ones that the executives care about, which is, do we get more patients? Do we get more revenue?
And you don't have to boil the ocean. That's the last thing I want to say
You
here,
don't have to.
because you don't have to rip and replace the entire thing at times, right? You can actually start into it in bits and pieces. You and I have talked about this from a content perspective too, right?
That's
Don't
the content stack idea.
Right? Don't look at, like, I have to redo my entire website. Maybe what you want to do is you want to focus in and optimize a certain thing here. Does that require a new CMS? I don't know. Figure out if your CMS can't scale with you, then maybe, yeah, it is time for that. But let's back into it in a way so you don't have to spend 4 years building a new website, and by that time everything's out of date anyway.
You're thinking about 3 strategic things you need to do to either prepare your organization for a digital transformation, restart the conversations around digital transformation, or continue to keep it going. What are the top 3 top of mind things that you need to think about? And not the patient journeys, not the use cases, not the external stuff, but selling inside of an organization about digital transformation. What are 3 things you need, either data or whatever it is? You tell me. It's your expertise.
No, no, I think data is one of them, right? At least try to be the detective and sleuth out where that data is. You have a hypothesis. Try to figure out if that hypothesis is accurate, that you can actually establish that. Again, those data people that we talked about. But that implies that you have to build good relationships among your organization, right? Many digital marketers that I know do not have that good relationship with your director of data and analytics or your clinical operations,
Yeah.
or whatever it might be. Um, in my mind, you have to get consensus around that. The other thing is, you have to understand exactly where the organization is going to go. And a lot of times, you don't know what that strategy is, or you can't articulate that clearly. Starting with the strategy and cascading down and developing your hypotheses to align with that strategy is very, very important.
What if you don't have it? Can you just say, okay, most health system strategies are get more patients, get more referring providers to send their patients?
Well, I think that's a good shorthand to think about that, but then it gets a little bit more nuanced, right?
It gets a lot more
Where are
nuanced.
those payers coming? Where are those
Right.
patients coming from?
Right.
What services are the ones that are you going to grow?
Yeah.
What services are profitable, right? And if we're going
Which
to drive
services
people
have access?
have access, exactly, and that's where you really have to, when you start to look at transformative initiatives, having a consensus of people across, I will say, these 5 disciplines in the organization. Okay, you have the chief strategy officer or the strategy team. Okay, maybe I'll just name them as C-suites just for
Okay.
shorthand.
Yeah.
The chief strategy officer, because what they will do is understand the business strategy, where the long-term vision, hopefully, of the organization is going to be, and where they're going to grow, and where they're looking to go 3 to 5 years down the road. Okay, that's the role of the strategy team or the chief strategy officer. Then you have your chief marketing officer, which assumptively they have a good understanding of the marketplace and they have a good understanding of the consumers in the marketplace. That's a big assumption, but that's really, I think, their role, right?
You saw that smile.
Yeah. Well, but I mean, but
They do. They do.
that's
I
yeah,
think for a chief marketing officer, if they're given what they need, they can do that very effectively.
exactly. And and sometimes they can only understand the potential customers, and they're not really heavily involved with day-to-day customers. So that's where your third role is the clinical operations or your chief medical officer, right? If you have them at the table, or someone, a representative from that team at the table, because they can understand the clinical aspects of this, and this is where it gets nuanced, right? Like if you want to grow one area of the business or a different area of the business, you might have to have different representations, but at least from a clinical representational perspective, they have a good understanding of like what their capabilities are, their access, etc. Also coinciding with that is someone in the operations, right, that can understand throughput, can understand access challenges. By the way, your chief strategy officer typically knows all of these people, and that's builds strategies around that, right? And then I mentioned there's 5, right? So the 5th one that's really important in this day and age, and it's the people we hate to bring to the table, it's your legal compliance people. Because ultimately you have to make sure that we as an organization understand. Marketers are we, as the voice of the customer is pulling us into a field in ways that we may not be as an organization ready to prepare to go to. You have to have them at the table to get them to be comfortable with that, because they can explain to you and outline the risks that are associated with it.
I want to say, when we do anything, we talk to compliance first, and we ask them, what are the guardrails? What do we need to know? I always tell people, if you go to compliance at the end of the project and not the beginning of a project, it's not getting published. It's not getting
Exactly.
launched, because they get annoyed. They're like, well, you could have
Right.
come to me and asked me, and I would have told you you can't do this.
Did,
And
oh,
then,
did I mention the chief CIO too, by the way?
well, I was going to ask. I thought you said 5, but I only
There's
heard
5.
4.
Yeah, I didn't get to the 5th, which is
Yeah.
the CIO,
Yeah.
right? Because they own the technology.
The chief strategy officer, the chief marketing officer, the chief medical officer, the chief legal and regulatory compliance, and then the chief information officer. Yeah.
Or representatives from those groups, right? And
Right.
it doesn't have to be the chiefs, but good digital transformation initiatives at health systems have those people equally committed on an executive stakeholder
Right.
group.
And the other thing that I would add to that I've seen in my work is that there needs to be either an owner or a co-owner of this work who's well respected and well regarded throughout the organization, because otherwise people aren't going to buy the need. But if those people really understand it and they own it and they're moving it forward, I think you can really see. I don't know if you've seen that in your work as well.
Yeah, I know. I agree with you 100% on that. Yeah.
Okay.
And you have to build continuous feedback mechanisms to those people as well, right?
Absolutely.
And be able to be comfortable to, you know, to negotiate with them.
Right. Exactly.
Well, maybe not the legal compliance people, but
Well, I was going to say lawyers are very creative.
Yeah.
If you say to them, tell me how to say this, or tell me how to get done what I want to get done, they will usually respond with, okay, let me think about it and try to figure it out. Unless they're like, no, by doing this, you're putting the business in danger. I can't let you do this. At that point, then you step away and just say, well, I'm trying to increase the brand reputation and the fiscal success of the company. I'm not going to do something to put that in jeopardy. A new website is nice. But what are the best ways to see if our digital changes are really making our patients happier and improving their care? So this is a metric question. And I know you and I have talked a lot about vanity metrics, like one of our favorite topics.
Right. Well, and that's because they're easy to measure, right? I mean, let's be fair, right? Vanity metrics are easy to measure. I remember back 15, 18 years ago when we were in the space, we were like, oh, we got so many people coming to our website, blah, 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 right? That's really not useful. But at the time, that was the best we could provide, quite frankly.
It's true.
Because that's all we had, right? And it gave us a sense. And I remember too, with early stage CRMs too, we were able to say, well, we did all this activity and people responded, they clicked on this email and they took the action and filled out a form. And now we're going to wait 6 months to see if that actually resulted in revenue, right? Yeah. Well, now we've built a framework and the technology's in place where we could actually really measure all of those things appropriately. Now be careful, right? You have to have a privacy first framework.
Yes.
And a lot of organizations were kind of shook up when we said no more Google, no more,
Right.
and
Right.
Meta saying no more, you can't measure, you can't
Right.
target audiences this way. But still, if you can be able to now close those gaps of measurement, and how I've found success to do that is this is where when you coalesce all the different teams together, the people in marketing, the people in IT, the people in charge of digital health, and say, look, we want to look at understanding the entire spectrum. I'll just choose a really good use case, a really easy one to kind of pinpoint.
Yeah.
Making an appointment with a primary care doctor, right? We want to drive more volume to our primary care. Okay, so then we break it down. We say, well, the top of the funnel metrics we can measure through the digital marketing environment. People clicking on the ads, clicking on the websites, coming through, et cetera, from a digital perspective. The referral pieces we can try to measure a different way, right, that they come through, the offline ways, so to speak, right? We can also measure through the patient portal returning patients, right? We have those metrics in place. But then when they make an appointment, let's say they use online appointment scheduling, they make the appointment, we could track to see how many of them started the journey and how many completed the journey. That gives us a sense of how difficult the funnel was. And then we could continue that down all the way down to how many of them made an online appointment schedule and showed up as opposed to not showed up or rescheduled. And this gives you insights along the entire spectrum of that journey. To do that, I think is a very important thing. Again, high impact, high reward. Spend time and build your coalition of data and analytics people to do that. Spoiler alert, many of them are already measuring it, but they're not tying it together in a continuous journey. They're measuring it to optimize their tools. So find those people that are the data analytics people, that are the clinical analytics people. They are data people. They love to help you. They love to paint together a much broader picture, right? And
Absolutely.
so that's the way you can actually start to solve that problem. You're not going to get, we're a number of years away to get true CDP, which is you have
Yeah.
understand every customer interaction. Some organizations, not health systems, but organizations like pharmaceutical companies and others have been doing this. But
they don't have the
cool.
regulatory problems that hospitals, especially, were faced with over the last 18 months. I mean,
and the changes, right?
And the changes, exactly.
Yeah.
Although I do think that hopefully seems to have passed, but you never know.
Mm-hmm.
Okay, Chris, where can people find you?
The best way to communicate with me is you can reach me on LinkedIn, Chris Boyer. Yeah, you can find me there. You can also find me on my website, christopherboyer.com. Touchpoint.health is where my podcast lives, but it's actually available wherever podcasts are available.
5 hot pink stars for that Touchpoint podcast. You heard it here first.
We have a really good one just recently about content. So
I know, so weird.
And you can also find me on Blue Sky.
Oh, look at you. See, Chris is always, on the edge of the envelope. Well, anyway, thank you for joining me. It was so great to have you here, Chris. And thanks to our viewers for joining in. I hope you got the answers you needed today. If you have a burning question, put it in the comments or email it to ahava.leaptag@ahamediagroup.com. We'll see you next time.